Welcome to another edition of Dianne Andrews in Black and White, an open discussion about the issues you don't want to talk about and the arts you need to know. Now, here's your host, Dianne Andrews.
Thank you, audience, for being here today. Thank you, people out there in TV land. As I always tell you, I know you're looking like we do up on the stage in your 3 to 5 inch heels with your hair done and your nail polish on and just looking good, so I can see you out there looking back at me. I also want to thank YouTube. We've only been doing this about 2.5 months, and you all have let me know and validated that these are the issues that you want to talk about. From Dale Brown to Maxine Crump to just people telling me the show has really changed their life. And for that, I appreciate you because I do this for you. And one thing I really wanted to do was Ebola. Ebola, fact or fiction, and we're going to talk about the Enterovirus, D68, that you don't hear too much about. Today with me, I have 2 guests. I have from New Orleans, Dr. Ratard, who has an MD, an MS, and an MPH, Masters of Public Health, Masters of Science, and a medical doctor. He is from near the Fiji Islands, is it, Dr. Ratard?
Yeah.
It's somewhere in the South Pacific. He speaks with an accent, and you know, everyone with accents is brilliant, but his degrees prove that he's very brilliant. He went to University of Paris. He went also to LSU and to Tulane University down in New Orleans, and he is our state epidemiologist. In case you don't know what that is, it's our state person of infectious disease. I also have Miss Shelley Upshaw, I'm sorry, and thanks Shelley for being here. Shelley is an MSN working at the Southern University School of Nursing. She works with the seniors, getting ready to go out into the world and face Ebola, Enterovirus, the flu, AIDS, all of these very infectious diseases. But we still want you to be armed with facts, not with fiction. We hear people saying that the Ebola virus, I heard somebody say it was in the hair. I heard somebody say, and this was a young person up at BRCC, that it can be transmitted through the air. No virus has ever gone from body fluids to be mutated into airborne. Is that right, Dr. Ratard?
Yeah. No.
So tell us, we hear all about Ebola. People don't know Enterovirus D68 has killed 7 people in America. No one has died who had Ebola from America. As we know, Thomas Duncan, who came from Liberia, who did not tell the truth to get into the country, but who was turned away, who did tell the nurse at Texas Presbyterian Hospital that he had been to Liberia, but it never got up the chain to the doctor. And protocol is very important. So tell us, what do you think? Should people be panicking over Ebola, Dr. Ratard?
No, obviously there are 2 diseases. You have Ebola, that's fairly easy to control in a country like in the US. Even in Nigeria, that does not have a lot of people, not as advanced medical system as
there are 150 million people, which is about half of what there are in America.
And they were able to
And they had 8 cases.
And they controlled the spread of Ebola.
Because they shut the borders down. I understand they did finally shut them down.
Because they really did a good follow-up on the contacts.
And isn't that important? Because I've heard every epidemiologist and doctor say that the best way to control it is to isolate it in geographical areas.
Yes, and chiefly when you have one, make sure you find all the cases, and around each case try to find all the contacts and follow them up to make sure they're not going to go spread them.
They said isolate, identify, and then try to rectify the situation by caring for the patient, right?
Yes.
Isn't the most vulnerable part of Ebola, again, it can only be contacted with body fluids. If I sneeze...
Yeah, it's a contact with the blood and the internal bloody fluid.
Now, what about sexual semen and things like that? Does it last longer in semen, I read?
It does last fairly long in the semen after. But that's, I guess there could be a few cases like that, but that's not the most usual way it's transmitted. When a person has no symptoms, they're not infectious. You just have to watch them.
Right.
First symptom is the fever. So take temperature twice a day, and as soon as fever comes, maybe now you want to start looking if they have Ebola or not.
But it also could be, the symptoms are very similar, right, Shelley, between Ebola, the flu, and the enterovirus to begin with. Of course, at the end of Ebola, you are bleeding out of your eyes and your nose and other areas of the body.
Some of those symptoms are very similar. Ebola may start off with a sudden temperature, and also enterovirus, and also the flu virus. Sometimes clients or patients might feel nauseous, weak, kind of malaise. You might have some nausea, some vomiting, and those are very indicative of each of those disease processes. So, you know, we want to make sure that patients and community participants are educated in that, to know that you do need to get tested.
That's right.
To discern, you know, which one you should be treated for.
And get your flu shot, because 52,000 people died last year of influenza. The flu virus comes from China, and there's no way to close those borders. We will have the flu every year, and every year the flu mutates. That's why we have to give a different flu shot every year. Right. Every 3 years, pneumonia mutates. So we get a different pneumonia shot every year. They are working on a vaccine for Ebola right now. Isn't that correct, Dr. Ratard?
Yes, there are a few candidate vaccines. And I guess in the old days, since it was very limited, there was not much incentive to develop one. But now with the big scare that scared everybody all over the world, my impression is that they'll come up with a vaccine fairly soon.
ZMapp was given to Dr. Bradley, who was over in West Africa. Specifically, the 3 countries most affected are Guinea, Liberia #1 now, and then Sierra Leone. Senegal borders Guinea. I had an interview, which is on YouTube, that you can go and watch, with a person from Senegal who came in 3 weeks ago from Senegal. Senegal has had 1 case of Ebola, and it borders Guinea. There have been 5,000 people to die in those 3 countries, and 10,000 cases. Since this started back in March, February, March, that it was reported to the World Health Organization, and then the World Health, and to America. But we seem to start panicking about a month or so ago. With the virus when it spread, you know, so rapidly in those 3 countries. But again, there are about 12 countries in West Africa. But I'm going to close for 1 second and come right back. Thank you. We'll see you in just a moment. Thank you. On the screen, you will see, on your television screens, you will see a map of West Africa. I want you to see there are 13 countries in West Africa. Senegal, again, borders Guinea. Senegal had 1 case that came in, and he came in from Guinea to get some help. They sent him back home to Guinea, and they closed their borders down, and there have been no cases. Only 3 countries with virulent Ebola cases. And again, Nigeria, with 150 million people, has only had 8 cases, and I think now they have shut the borders down. Most of the countries around, from what I saw, and you would know better than me, Dr. Ratard, have kind of closed their borders to those 3 that have had 10,000 cases.
Closing the borders depends on the details and how it's going to work. It's a different story closing the borders in a small country, the country that's next door where people can go. It's a different story in Europe, it's a different story in the US. And you hear all kind of opinion, and right now it became a political debate.
We have everybody coming in, which you cannot come direct or straight from any of those 3 affected countries, Liberia, Guinea, or Sierra Leone, into America. You have to go through Belgium or some other country, but I understand they have to come into only 5 airports now, which are Atlanta, Dulles,
those are the hot
and
spots.
they're doing the infrared, Chicago, you know, and JFK, of course. And they're doing the infrared to see if they have the fever, but of course the next day, because it incubates from 2 to 21 days. Is that correct, Dr. Ratard?
So the next day they will let the local health department or the state health department know, and you just have to monitor the people for 21 days, taking their temperature twice a day.
Well, what we really want, again, is for people not to panic. You have to be with someone when they're in heavy virulent stages. When they have high temperature, they're probably vomiting, diarrhea. The two nurses that ended up with it, one is in Emory right now, and one is in Bethesda. I mean, that was the first case in America. So you would expect, not want it to happen, but expect some of the protocols needed to be changed. Now, the Nursing Association is asking for 4 to 6 weeks of training on Ebola for the nurses. What do you think of that, Shelley?
4 to 6 weeks is a long time,
Yes.
Diane, to be honest with you. And, you know, we try to train our students in the School of Nursing right now, today.
Right.
We've had conversations with our students on the information, on the CDC guidelines. And our students are very well versed in protocols at different facilities. So 3 to 4 weeks is a long time for me. We need to get trained now.
Right.
We need to put some preventive techniques in place now.
Right.
We need to educate right now so that patients know, healthcare healthcare staff, and they know what's going on. So that's it's a long time for me.
It is.
It's a long time.
I'm in healthcare
and so
also.
much can happen.
Right, between that span of time. And as we've talked about before, communications needs to get better inside that hospital, between the staff, the doctor, the aide, and the nurse.
And you know, nurses don't take care of patients by themselves.
That's
This is
right.
a team effort.
Right.
It's a collaborative effort, and sometimes I'm a little concerned that nurses, being the frontline providers, kind of feel the brunt of everything, whether it's positive or whether it's negative.
Right.
So, you know, it's a team effort. It takes nurses, physicians, nursing aides,
Right.
physical therapy,
That's
PT.
right.
You know, this
Speech
is
therapy, everything.
all of
Yes,
that.
yeah.
You know, it is truly
Dietitians
a
in the hospital, making sure the
multidisciplinary
diabetic
approach. So
patient
it's
doesn't
not-
get
Right,
sugar,
right.
a piece of cake.
Right.
Yes.
And we educate our nurses. There are some excellent programs
But
out
don't you
there.
think there's some lacking in communication in the nursing, critical thinking sometimes, and I'm not trying to be negative at all.
No, not
but
at all.
don't.
I think it's a concern.
It's a concern. You have
It is-
seen that because you go out. You actually
is
go
a-
out into the community and community health facilities in your job and work in the community
It is
with
a
people.
concern, but you know, we really try hard and we take our jobs seriously.
Right.
That, you know, we instruct our students in how to critically think, how to think creatively, how to be innovative, how to
Right.
approach a patient individually, because everybody is unique and everybody will come in with a different set of symptoms.
Right.
So we teach our students to critically think. Yes, there are some problems with communication in hospital facilities and community facilities, but the standard is that we communicate. In nursing, we call it the handoff. When you transfer a patient from the ER to the med-surg unit, or from the nursing home to the emergency room.
Right.
But it is a handoff. It is a
Yeah,
process.
acute care to a long
and we're
term care
we are
unit, yeah.
trained in that process, so
Right.
we know what we need to do.
But sometimes it
is
just doesn't happen.
It is a concern.
Yeah.
It is a
I know
concern.
that our protocol in the CDC had not been, I don't think, in the beginning to use bleach. MSF in Africa uses bleach, kills the virus of Ebola. Of course, you don't want to throw it all on your clothes, but if you think you have Ebola, you may want to throw it everywhere you can. Wash your hair in it if you have to. But bleach will kill Ebola. That's pretty much
Ebola
said, right?
is a very easy virus to kill,
Yeah.
because it has an envelope. And this type of virus, any disinfectant will kill.
Even, is ammonia, is that considered a disinfectant?
Not so much.
Oh, okay.
So it's easy to kill. You want to use a better disinfectant, but alcohol that will not kill the norovirus easily, alcohol can easily kill, and kill is it's a strange word to use for a virus.
It's much more easy to kill than the flu virus, isn't it?
Yeah, to inactivate, we
Yeah.
say, because the virus is not especially alive, I
Right.
guess.
Deactivate it.
Yes.
In layman's terms, kill it, but
Yes.
in medical terms, deactivate the virus.
Also, it's important to notice that the few people that were living with that case in the apartment for 3 days.
That's right.
Nobody
in Dallas with
got
Thomas
infected.
Dunking, nobody has the disease. I think that's a great
And
testament
that's
of how it's
the-
not that easy to catch. They were with Thomas Dunking when he was virulent, after he got the high fever,
Right.
and they still don't have the virus. And
Yeah, because it was at the very beginning. It's very infectious at the end.
Yeah.
You know, in one 1 milliliter of blood, you have about 100 million virus at the very
And
end.
1 milliliter would be about a thumb's worth
More
of...
or less, yes.
Yeah.
So very
The top of the
infectious at
thumb,
the
I'm
end
sorry, yeah.
and not very infectious. People were living in the apartment and they didn't get it.
I was listening on television one day. It was a lady passing by. She went by the apartment where Thomas Duncan, the man from Liberia who ended up dying in America from Ebola, was. And she had her son in the back of the car. She had him in all kind of protective gear, and she had a T-shirt stuffed in his mouth. And she asked the guy cleaning out Thomas Duncan's apartment, cleaning it with bleach and everything like they did Frontier Airlines, who transported Amber Vinson, the second nurse who is hospitalized with Ebola, asked him, where could I go get an Ebola test for my son? So, I mean, we've got to stop the panic. Again, go get your flu shot. It's much, I've had the flu twice and it almost killed me. And I'm going, after tomorrow, I'm getting a flu shot because you don't want to present yourself at the hospital. The symptoms are very similar between enterovirus D68 and Ebola in the beginning and the flu. So, any other words of wisdom or anything you would like to say?
Just know that we as nurses coming out of Southern University School of Nursing are prepared. We educate
Tell me how
our
Southern
nurses.
University ranks in the status with the rest of the schools
You know,
in
Southern
Louisiana.
University School of Nursing is one of the top 10 producers of African American nurses.
And you have white Caucasians. I've seen, I know some who have worked for me who are
Absolutely.
Caucasian.
We have educated over 1,500 nurses that practice locally, nationally. Our nurses are well versed in protocol. They're well versed in standard precautions, universal precautions. So they are very well aware of what they should be looking for.
That's not a 4-year, 4.5, or 5-year program just for the BS.
We have two separate programs, an undergraduate program and also our graduate program. The undergraduate program, our nurses graduate with the BSN. That's a baccalaureate. It's a 4-year degree. 4-year degree, excuse me. The graduate program, we have the master's program, postmasters, our new program, the DNP, the Doctorate of Nursing Practice, and we have the only PhD of nursing in the state at Southern University. So
I know Dr. Ramey is very well respected everywhere around the country.
We have faculty and instructors.
You have an NP, right? Also, right? You mentioned masters, but you do have the nurse practitioner
also, right?
We have
nurse practitioner and also the DNP. So come and see us.
How many students can you take at one time in the undergrad program?
In the undergraduate program, we probably admit, we usually get about 200 to 250 applications. We admit anywhere from 80 to 100 every semester. So we're probably graduating close to 200 nurses, undergrad as well as grad, every year. So on average,
that
about
program has really grown in the last 5 years, hasn't it?
We have grown, and we're ready to make some changes and do some great things.
That's great. You're already doing great things. We appreciate the School of Nursing out there and what you all do to prepare the students to go out into these kinds of environments. But definitely, again, I can't say enough. Don't panic over Ebola, and let's stop all the Facebooks and the websites and the emails on it being airborne. It is not airborne.
Get your flu injection.
That's right.
Wash your hands.
That's right. Wash your hands. Use universal precautions, you call them in healthcare. Well, let's talk about the corpses a little bit, Dr. Ratard. Now, the corpses, after a person passes on from Ebola, many did in those 3 countries where it became so virulent, the corpse is a problem because, of course, when you talk about these countries, they're underdeveloped, underprivileged, impoverished countries. They don't have the same kinds of mechanisms we have to get people out of the hospital. That's why right now we have 4,000 troops in Africa building clinics. We have sent 4,000 troops over there to build clinics and to help with the Ebola virus. And I know many of them are staged in Senegal, 3,000 of them, because as I said, I interviewed a guy from Senegal in Dakar, which is a beautiful city, which looks like Paris. Senegal was a French colony for many years. Everybody there speaks French. And Dakar, not the one in the Middle East, Dakar there is laid out as a city of Paris. And I told him I'm coming to visit that city. Paris is one of my favorite cities in the world. As you went to school at the University of Paris, Dr. Ratard, right? Did you love Paris?
In school, no. There's too many people. To visit, it's wonderful.
Yeah, beautiful.
But
City
to
walk.
live there, it's like any big city.
Yeah. So tell me about the corpse. How long does the virus last on a corpse?
It really will depend how the corpse is preserved. What happens fairly often in Africa is that people have their traditions, their way of dealing with the corpse. They want to wash it. They want to. They have things to do that involve themselves getting hands-on with the corpse, and that's extremely dangerous. You realize that maybe at that time, when the person dies, you may have up to 1 billion viruses in every little remote corner of that corpse.
Yeah.
So it's easy to get infected.
I'm surprised that more people don't have it in those very closely together
Usually, if
countries.
somebody is going to go wash the corpse and the person was bleeding a lot,
Yeah.
it's 100% of those people that are going to get infected.
Which at the end, everybody with Ebola in final stages bleeds. I read. Is that correct?
Yeah,
out of
at
the
the
eyes, out of the nose. Yeah.
And of course, then you will have
Mouth.
it everywhere, and you would have to stay away, far away, not to get it.
Now, I
So-
read that 50% of people, even if they're around someone with it and touch them, don't get it or don't die from it. So everybody does not get Ebola that's even around someone with Ebola.
Yes.
And-
And with the treatment, very early treatment, you can see that a lot of people survive. Maybe even less than 50% would die if you get, if it gets caught early and treated. And it's mostly a supportive treatment. Fairly soon, they may have some drugs that are going to help out.
Right, the ZMapp, as I had said earlier, Dr. Bradley, who was overworking in West Africa, was given ZPAP. It was an experimental drug out of Canada. He came and he had built up the antigens, and they gave a blood transfusion to Nina Pham, the first RN with it. And I think that's why. I think both RNs now in fair condition.
And one of them, I think the family has actually put out a statement that she's Ebola-free, but we're not sure. The hospital hasn't actually said that. But
Well, I saw
her
Nina Pham on
family
the computer.
is-
They had a picture of her last week. Did you see her on the
good,
computer?
yes. Yeah,
I
they're
said, she
looking
looks better
good.
than me. And they flew them, you know, to those we have 4 facilities in America: Nebraska, Montana, Emory University, and then at Bethesda, Maryland, that are handling the Ebola cases. So hopefully there are no more cases. But if there are a few more, again, look at that enterovirus that is airborne. If you're sitting next to someone who has that, I was flying to Florida a week ago, and there was a Tulane nursing student sitting next to me. I carry a mask with me, and this student coughed all over me. I had been sick for 2 weeks. So that's why I am getting my flu shot tomorrow. And I would tell you all, let's get out there and do the same. 30 to 50,000 people die every year between the influenza virus and pneumonia. That just is a picture showing you of some of the people in the protective gear they're wearing in Africa for Ebola. We'll be back in just a few minutes, and hopefully this cuts out the panic. Hi, welcome back to Dianne Andrews in Black and White. Now I have 2 guests with me. One a student at Southern University, E.J. Rogers.
Hi, how you doing?
And I have the national president of the Alumni Association, Preston Castile.
Hi.
Preston is also an attorney. He went to undergrad at Southern University and went to grad school at Tulane University in New Orleans. But he does this as a volunteer to help Southern University. And we're talking about some ideas with the Alumni Association that I'll tell you, I came up with it a minute ago. But first we're going to talk about the Bayou Classic. This is the 41st year of Grambling playing Southern University. And fate would have it that it is a tie. Grambling has won 20 years. Southern has won 20 years. This is the 41st game, so guess what? This determines the winner between Grambling and Southern to have bragging rights. Someone from Grambling was supposed to be here, but they didn't make it. I think they were scared to come to Baton Rouge already. So Preston, thanks for being here.
Thanks for
and
having
tell
me. Thank you so much.
Thank you for the time that you dedicate to Southern University. But, you know, we are going to say, Grambling, you do have an equal amount of chance to winning as we do, I guess.
Absolutely.
Up here at Southern University territory. And we want everyone to come November 28th to the Bayou Classic, which we already have 200,000 people. in New Orleans for that weekend. Tell me, what is the alumni doing to make it a better weekend for Southern? Because we get money from this. Grambling gets money and Southern gets money from this.
Absolutely. You know, the whole idea of the Bayou Classic, it's an opportunity for the two schools to come together, Grambling and Southern, and we have the football game, but we have all sorts of other events in terms of the Battle of the Bands, in terms of the Greek Show, business events, and a lot of these events are intended to raise scholarship money for the university, and our alumni associations and our foundations exist to help these universities. We've got a football game that Southern's going to win. But at the end of the day,
okay, Grambling, you have an equal chance. I have to say that. Okay.
Absolutely, but because I represent Southern, I will say Southern is going to win. They're going to break the tie. They're going to come home with the trophy for good. But that said, at the end of the day, it's all in the spirit of fun. It's an opportunity for family and friends to come from all across the state.
200,000 people are there that weekend. That is amazing.
When we swarmed New Orleans right after, well, and not only right after Thanksgiving, but we've got activities that entire week. The Wednesday, the Thanksgiving Day Parade, which has become a huge attraction. It is a great family-friendly event.
Yeah, I think they get over 40 or 50,000 people at the Thanksgiving Day Parade for the Bayou Classic. Have you ever attended it, EJ?
I actually have. My little sister was Miss Southern, and I went to attend when she was on the float.
Erin.
Yeah, and I thought it was very interesting. You know, it was a very fun time. Not like Mardi Gras, but
it's not like the Macy's Day Parade, is it? But do they have different floats of
I will tell you,
turkeys and things, or what?
No turkeys, but certainly big floats.
Yeah.
And it's wonderful. I was in it last year, and the Alumni Association had a float. It was a lot of fun, people coming out, not only just the local folks, but people from all over the state and the country. They're in for a holiday. They come and enjoy the parade. Of course, we have the bands playing. It's
right, and like Southern always has had the best band.
Nothing like having the human jukebox play for Thanksgiving, and people love the band, and they're, you know, an incredible organization, and we're so proud of them.
And Grambling has done better with their band.
Yeah, Grambling
I
has
am
done
from
better.
North Louisiana, and I am from Grambling territory. Cool. So, Preston, we were talking about, too, a little bit more on alumni things, and I suggested, before he steals my idea, and I had mentioned it to some other people at Southern for years, for alumni to get more involved with coming and help. Southern needs painting, things like that. We could put together a program for that, but also, I was at IBM for many years, and I never received one email, one letter asking me to donate. And they have matching grants. My friend went to Hampton, and at Hampton, she said she's broken. I get something every week. So I said, why don't we give those interns the opportunity to get a grade and then build an alumni database? We could start work on that.
And I said that's a wonderful idea. What we've done since I became president about 3 months ago is that we've hired additional help. We're shoring that up. I think now you're getting our e-blast every week.
Yes, I am. I'm part of the Alumni Association, which is great.
So alumni members are being touched all across the country. But there's always
Are you getting much response from that?
Oh, it's been incredible.
Well, we're going to continue that response, and thank you very much for tuning in to Dianne Andrews in Black and White.